Good morning. To say that I am overwhelmed is an understatement. I'm just a cricketer, somebody who barely graduated Bachelor of Arts, just about graduated in the past class. And for me, therefore, to be invited to speak here at this convention of what I have always believed to be the greatest profession in the world is an incredible honor. It's an incredible honor. It's a huge, huge privilege just to be amongst you, because there is no greater profession than the profession that cures the unwell, that eases the pain, that brings succor to so many millions all over the world. And therefore, for me to be amongst you here, even if it's for a short time, like I said, is an incredible privilege. I wanted to become a doctor because my auntie, my father's youngest sister, was a doctor. And she practiced medicine. She had a clinic in Mumbai in what I would say, a financially challenged sector of society. And those were the days, of course, when along with the doctor, you also had what was called a compounder who made the medicines for you by sort of grinding the mixer and giving you the medicine. But the patients that came in the clinic and the reverence with which they looked at her, that love, that affection, that reverence that they had when they just looked at her, was something that struck me. I was only maybe about 7 years old, 6, 7 years old. I used to live not too far away, so my mother would take me to the clinic because my auntie was very fond of me, and I was like a little bit of easing some of her time when she was busy. She would ask me to mimic, because I love cricket, she would ask me to mimic different wicket keepers, different batters, their styles. And that would be her little entertainment before she went to look at another patient. But like I said, the reverence with which she was looked at was something that stayed with me, and I wanted to become a doctor. So therefore, my first ambition was to become a doctor. But then, a couple of years later, I realized that I didn't have the kidney to become a doctor. So I gave up on that, concentrated on my studies, because cricket was not a career option then. If you did well, reasonably well in cricket, you were able to get a job, because corporate cricket, intercompanies cricket was very big at that time. And that's how life progressed for me. But sometimes God above is looking. He knows that you've had this little ambition which was unfulfilled, and so He does something. And so what He did was, as soon as I finished playing cricket, He had the Annamalai University in Tamil Nadu give me a doctorate in sports. So technically, I can use the DR in front of my name because of that. Subsequently, of course, I was blessed and fortunate to get a few more doctorates, but nothing compared to what you all do. I also recall when my father had a problem, and those were the days of a rest day between test matches, and I was able to fly in from Madras and come by his bedside. He was all wired up, and it was a scary sight. Just to see somebody who was as fit, as active, just lying in bed. And his doctor was there, and he said to me something which at that stage didn't make any sense, because I'd flown in from Madras to see him. And he said to me, "Please go away now." This was in the evening. "Come and see him in the morning." And I said, "Why are you saying that? I've come to see him." She said, "No, I don't want him to see you." And I didn't know what he meant. He said, "No, I don't want him to get excited by seeing you and put more pressure on his heart. Let him relax for tonight. Then you come tomorrow morning, and then you can see him, by which time we'll have monitored him and we'll have seen how he's progressing." And it is at that stage it struck me, how important it is to look after your own health. My father, after that, was very, very careful, lived for another 40 odd years. And he also got me to look after myself, to make sure that I tried to keep as good health as possible. Of course, as you get older, things are a little bit different. But my connection with cardiology, if one might call it that, has remained because of the Heart to Heart Foundation, of which I am fortunate and blessed to be a trustee. The Heart to Heart Foundation has been helping the Sai Sanjeevani hospitals in India to perform totally free of cost surgeries for children born with congenital heart defects. There is no cash counter at any of these hospitals. The children generally come again from financially challenged sectors of society. A lot of the problems are mainly due to malnutrition. But when the parents come and they hand over their child at the hospital, they are taken care of. So there's an annex where they can stay during the time that their child is in hospital. And we've had a success rate of over 99% in all the surgeries that have been performed. And over the years, over the last 10, 12 years, we've performed almost 36,000 surgeries, totally free of cost. I call this my third innings in life, because this has been the most fulfilling of all my innings. My first innings as a cricketer, my second innings as part of the media, part of the administration, doing a little bit of business as well. And this third innings is the most fulfilling, because to be able to see the expression on the faces of the parents, the anxious parents who come from the interiors, from the villages, who have never seen that many people when they come to a city, who have never seen that many buildings, they've never seen that many cars, and they're completely, totally bewildered by when they come into the city. And then their child is not well, and they are completely, they're nervous, they're anxious. But once the doctors come out, and our doctors have been fantastic, once the doctors come out and tell the parents that their child has been successfully operated upon and the child is going to lead a normal, healthy life, the change in the expression from the bewilderment to anxiety, to disbelief, to relief and the tears of joy has given me more pleasure than scoring a double century for India. And that won't happen without all you wonderful people who perform these delicate operations. We're talking about children, so you know how small they are. their heart would be. And to be so precise, to be able to do that delicate surgery is something that is a God-given gift, and I can only say that once again that I'm just overwhelmed to be in the presence of you all. I just want to once again reiterate that this has been an absolute honor, thanks to Ajay, Jasprit Bumrah. Jasprit Bumrah was always at the batsman. He's always been at the batsman. He's been at me about attending this function for the last so many days, so many months actually, checking with me, when is the IPL starting, will you be able to attend? So he's been like a Jasprit Bumrah, and it's thanks to him and Dr. Ashwin Mehta that I've been able to come here and be with you and to be able to breathe the same air that you have. May I thank you once again for having me here, having a BA pass class amongst you all. I just want to say, God bless you and please continue